Brain is arguably one of the most important organs in the human body since it controls and coordinates the actions and reactions of a person. However, like other organs, it is susceptible to various diseases such as infections, seizures, and the most common, brain tumors. Brain tumors, which can be malignant or benign, is an abnormal mass of tissue in which cells grow and multiply uncontrollably. While some persons with a non-cancerous brain tumor can live up to 10 years, there is a 36% 5-year survival rate for persons who have malignant brain tumors. Locally, there has been a noticeable increase in the amount of persons who are being diagnosed with tumors. This disturbing information was disclosed by Dr. Armanauth Dukhi during an interview with Nightly News on Wednesday.
There is an extremely large amount of, or a large group of people with brain masses. I like to say brain mass. Then you classify what type of lesions they are in terms of tumors, other types of mass, brain mass. We have seen an increased numbers of people with brain tumor nationally or locally.
Dr. Dukhi, who is distinctively known as the country's only neurosurgeon, has been in the medical profession for 8 years. As such, he conveyed that while brain tumors affect both males and females, men are more susceptible. He explained that brain tumors are caused by several factors, and while the most common are gender and age, an infection in the body can also heighten a person's chances of developing a brain tumor.
Some people that are exposed to viral infections are more likely to have brain tumors. For example, our HIV patients who are not on antiretroviral drugs, the tendency of them developing brain masses also exists.
He noted that Guyanese are often hasty to self-diagnose, but warned that what some may deem a normal migraine may be an early sign of the existence of a brain tumor.
One of the most frequent symptoms or early signs of brain tumor is headache, and it's simply due to the signs of increased intracranial pressure, because the brain tumor is a mass-occupying lesion, and then our skull is a closed vault, so there's no room for expansion, so other vital structures of the brain will suffer.
In addition to headaches, seizures was also listed as one of the most common early signs. According to the doctor, early detection will increase a person's chance of survival. The increased patients being diagnosed with brain tumors, coupled with the restrictions of the pandemic, have resulted in a backlog of patients waiting to access surgery.
There's an extremely long list of people waiting for neurosurgical care, and we actually handle them. We end up have to deal with them on an emergency, absolute emergency, relative emergency basis. So we still have a lot of work to do.
Dr. Dukhi is adamant that when the country returns to some state of normalcy, he will be able to facilitate more surgeries. While Brain Tumor Day was observed on June 8, Dr. Dukhi is adamant that awareness of the seriousness and impacts of brain tumors should be an ongoing campaign. Reporting for the HDP Nightly News, Kendell Richmond.